What is Ozempic, Dick? Ozempic and similar drugs have taken the world by a storm. Even if you don't have diabetes or you're not overweight, you have probably heard of the medications Ozempic, Wegovy, Mounjaro. But have you heard of Ozempic, Dick? What are the effects of these drugs in the penis, and how can you avoid this? Hi, I am Dr. Tenji Nikakwasco, Dr. Tenji, the sex doctor, board-certified clinical sexologist. If you are new to my channel, I am so happy you found me and want you to stick around. I openly, honestly, and without shame or judgment talk about all things sexual, sexual health, sexual behavior, human sexuality, sex. My goal is to grow this community so we can have real sex conversations unlike what you can find elsewhere. So do us all a favor and subscribe so that we can continue these conversations and they can continue to keep bigger and better. Thank you. So, Ozempic and your penis. What is the connection? Before I tell you more about how Ozempic can affect your penis, let me tell you briefly about these drugs. GLP-1 drugs, also known as glucagon-like peptide 1 receptor agonists, incretin, nematics, or GLP-1 analogs, are a class of medications used to treat type 2 diabetes and, in some cases, obesity. You may know these drugs by their prescription names: Ozempic, Wegovy, Mounjaro, and others. For the right candidate, these drugs have been shown to lower certain risks in people who also have heart disease, including heart attack and stroke, help manage blood sugar levels along with lifestyle improvements in diet and exercise, and help people 12 and over lose excess body weight and keep the weight off. There are other uses for these drugs that are being currently studied as well. This is not a segment on GLP-1 medications, so if you're curious about them and have more questions, you may browse YouTube and the web for more. There's a lot of information. Or talk to your healthcare provider if you feel like you may benefit from using these kinds of medications. If you need these drugs and are taking them, please always consult with your healthcare provider with questions. If you're taking these drugs, do not stop them based on what I will talk about. Bring your concerns to your prescribing physician and discuss your options. If you think you would benefit from using GLP-1 drugs to manage your diabetes or weight loss, be armed with the right information about these medications and make decisions based on your whole health picture and not based on just one aspect. Remember that taking medications always comes with a risk of side effects, but so does living with unmanaged chronic health conditions. So weighing risk versus benefit and the greater impact to the most important aspects of your health should be your goal. Now, back to Ozempic, Dick. Non-diabetic men treated with semaglutide, found in Ozempic and Wegovy, appeared to be at an increased risk for developing erectile dysfunction and hypogonadism. Although the rate was low at 1.4% versus the control group, these findings are significant. The researchers were not expecting to see this, so they actually found that the findings go in the opposite direction of what they expected, that weight loss would improve actual erectile function. Although the package inserts for semaglutide, they do say that one of the side effects is actually erectile dysfunction. It is important to highlight that this study was actually done and found this to be true for non-diabetic men. Non-diabetic men prescribed semaglutide were more likely to develop ED compared with the control group. This is the first study regarding how Ozempic and similar drugs may affect sexual function in non-diabetic men. However, other studies have found that long-term use of dulaglutide, for instance, might reduce the incidence of moderate to severe erectile dysfunction in men with type 2 diabetes. This all means that more studies are needed to understand these findings, and further studies are warranted to find out more about the connection between GLP-1 drugs and sexual function. Will Ozempic make your penis larger? I've seen this question regarding penis size and the use of GLP-1 drugs. Does using Ozempic and similar drugs lead to a larger penis? Can these drugs make the penis grow? Unfortunately, the answer is no. However, if you lose weight, and especially for people who have big amounts of abdominal fat, when they lose the weight, they may be able to see more of the penis or see the penis when they were not able to before. They may also be able to reach the penis more easily and feel the whole penis in their hands that they were not able to do before, hence making them happier and appear that the penis is there when it wasn't so before. But no, taking Ozempic will not add length or girth to your penis. We definitely need more studies to find out how GLP-1 drugs may affect sexual function in women and sexual desire and performance in both men and women. GLP drugs like Ozempic, Wegovy, and Mounjaro, to name a few, may be in the spotlight right now, but despite their increasing popularity, both clinicians and patients should be aware of potential hormonal effects and have the necessary conversations when considering these medications. How can you avoid all this? If you're struggling with weight and type 2 diabetes, please do yourself a favor and manage your health. The healthier you are metabolically, the better your sexual function. The better your cardiovascular system works, the more efficient your penis is in doing what it's supposed to do. A healthy you means a healthy sex life for you, so stay healthy. This is Dr. Tanji, the Sex Doctor. See you next time.